Hey, everybody. Today, I'm excited to introduce you to our newest physician, Catherine Isaac. So I call her Kat. You should call her Dr. Isaac. But Catherine, why don't you introduce yourself to the world who doesn't know you yet?
Hi, everybody. Hi to the Bionic community. And my name is Catherine Isaac. I'm an internal medicine physician. I've been practicing now for over 10 years. And I did my medical school training at Weill Cornell in New York City. And then I went on to do my internal medicine residency at Beth Israel Deaconess Hospital in Boston. It's a Harvard affiliated hospital. And then after that, I went on to work at the Benson Henry Institute for Mind Body Medicine. And I've always had a very strong interest in providing my patients the tools they need in order to take care of themselves. So things like stress management, exercise, lifestyle-oriented stuff has always been super important to me. So I'm excited to be here at Bionic.
So I always think it's interesting to start off with kind of origin story. I mean, I feel like all physicians are somewhat some sort of superhero. And so tell us your origin story. What was like your childhood? How did you decide I want to be a doctor someday? Like, how did you end up here?
Sure. As far as I can remember, I've always wanted to be a doctor of some sort. And my mom always liked to show this video of me when I was 5. At that time, I wanted to be a doctor of the teeth, which was dentist. But then I moved on to wanting to be a geriatrician and enjoyed doing like cognitive testing on my old aunts and uncles, testing to see if they were losing their memory. So yeah, I just have always been fascinated with how the body works, understanding the anatomy, and have always had a strong desire to be helpful to others as well. And in addition, I think part of that origin story, if I'm honest, is both my grandmother and my mother had a hereditary bleeding disorder called hereditary hemorrhagic telangiectasia. And I'm actually adopted, so I didn't get that gene passed down, obviously. But they suffered from pretty severe nosebleeds, hereditary it's a hard thing to say. HHT is a vascular disorder where you have these blood vessels that are fragile and they bleed and rupture easily. And so normally where you would have a small amount of bleeding in an area because you have it coming from the capillaries, it's from this abnormally produced blood vessel that has an unusual structure, so you have higher blood flow. So she would get nosebleeds, my mother, and it would bleed quite heavily, not just like dripping, like, it's like someone turned a faucet on. And so when that would happen, the only thing I could think to do is how could I be helpful? So I would try to, get her medicine, get her tissues, help her to the bathroom, get her ice and water, and just try to be there. So I felt like when I was able to be useful in that way, I was contributing. And I thankfully have been able to achieve my dream.
It's always interesting to me how those early childhood kind of experiences shape who we become and so much of who we are. And obviously helping your mother, being worried about your grandmother, like that obviously shaped a lot of who you've become. Now, when you went to medical school, did you know that you wanted to do kind of family medicine, holistic care? Like, what were you thinking when you were headed into medical school?
It's interesting. I came across this book right before starting medical school, and it was a book about like nutrition and I think it was actually Curb Your Cravings. And my roommate had gotten the book from somebody through work. And when I picked it up, I actually found out it was a book about Ayurveda and the different types, which I can't recall what they are right now. The doshas, maybe, I think. Anyway, so I just became really interested in how eating from a different perspective for each body type could be more useful and could curb cravings. And also growing up, my brother was very into fitness, physical trainer, and he's a retired firefighter. And watching him, he was always interested in how to eat healthfully and exercise and strengthening his body and kind of pushing the limits of what your mind tells you you can and can't do. And I should mention my other brother too, because if he watches this, he's gonna be like, "Why are you talking about one and not the other?" He's a retired police officer, so they both were super fit, super jocks. So I just was always very interested in how, we have the potential to strengthen ourselves. So coming into medical school, I wouldn't say that I knew for certain I wanted to be a primary care doctor, but I did know that I wanted to be able to be, again, useful. And I felt like if I had specialized in one particular area or another, and somebody asked me a question, I'm not going to be able to be helpful. So that definitely was was one of the reasons I wanted to do primary care.
It's funny. I don't know if you've had this happen to you on flights, but when they call for a doctor overhead, and twice I've gone back and it's a dermatologist taking care of the person. And so I'll explain really quickly, hey, I'm an emergency medicine physician. I'm gonna take over. Uh, but
Yes.
have you had any flight adventures yet?
No, not yet. And I also want to just say thank you, dermatologists, for even though you know you're a dermatologist, still getting up, standing up, and on offering to help.
Totally.
So we appreciate you.
Totally. I know my radiologist friends are just staying in their seats. They're not even getting up. The dermatologists, at least, are getting up. So, and it's fascinating that you and your two brothers kind of went into these service oriented roles, right? Firefighter,
Yeah.
police officer, physician. And you obviously trained at kind of elite places, Cornell, Harvard, and ended up when I met you, you were working at Duke. So really kind of name brand medical centers, right? Um, but I think one of the interesting things you talked about to me in the past was your early kind of exposure to somebody that was practicing medicine, maybe not completely the way they were doing it at Cornell or Harvard. So, do you mind sharing a little bit of that story with everybody else?
Not at all. So in first year of medical school, we have the opportunity to observe in a doctor's office to see how they interact and interview patients and also practice our skills at checking blood pressure. So my first mentor had a private practice on the Upper West Side of Manhattan, which was actually an integrative medicine practice. And he was a DO, a doctor of osteopathic medicine, and he was also trained in something called craniosacral therapy. And he had designed this practice that was very unique for the time. He had a chiropractor working with him. He had an acupuncturist. He had a kinesiologist. And what I loved about his practice was he's kind of had the philosophy of the philosophy that we have at Bionic right now. So trying to explore more than just the basics of what's going on, but understanding the biology a little bit better, trying to fine tune that. And then just, again, thinking about how all of the systems of the body integrate, how stress impacts the body and stress would exacerbate pain. So one of the things that stood out to me when I was working with him was that he would step out of the office after he did an adjustment, which is where, a manipulation of a joint or space. And he would let the patient lay on the table and he would say, okay, stay here for a few minutes until you feel ready to get up. And then you're all set to go and you can stop at the front desk and make your appointment. And whenever the patients would leave, they appeared to seem, feel really rested and calm and at ease. And I just loved that whole kind of experience that he seemed to craft for the patient when they came in. He sat next to them. He, was very caring and warm, but also really kind of dove very in depth on what was going on with them personally, as well as, from a medical perspective in terms of their lab work, et cetera. So, yeah, he was a phenomenal doctor. And I was actually thinking about him this morning and thinking he's still probably the best doctor I've ever worked with.
Well, it's interesting to hear you talk about the way that he practiced medicine. And then as I've gotten to know you and watch the way that you practice medicine, I see a lot of those same attributes. I mean, you you care a
Thank you.
lot, you spend a lot of time with your patients and really try to help them understand as much as possible. So um, after first year medical school, right, you choose to become a family medicine physician and you go off to training. But it's interesting to me that you ended up doing kind of this mind body medicine work. Um, so tell me a little bit about that.
Yeah, and just to clarify, I'm internal medicine,
Ah,
so I don't want to step on my family medicine
uh,
docs' toes. They have additional training that I
that's
do
true.
not,
Not going to deliver
and
babies.
I'm not going to deliver babies. I can't do surgery, so they are very, unique in their diverse set of skills. Um, but so yeah, after first year of medical school, I'm working with my mentor. Um, I also began working with someone at his practice who was doing kind of Reiki healing, hands on touch therapy, and she was working with cancer patients at Memorial Sloan Kettering at the time. And this was just way outside the box from anything I had ever seen or experienced before. But again, I was fascinated, and I think I was like a I'm going to be a little bit of a nerd. I was like a pluripotent cell. There was, I could be anything at this time. I could explore anything, learn anything, and I was just really curious about what it was that she was practicing. And again, I started to learn about touch therapies and energy healing and kind of concepts about that, and just seeing how it had a positive impact on people who are experiencing chronic pain, going through kind of traumatic experiences or cancer diagnoses. And it just opened my mind to the idea that there are things that we do not yet understand. And there are systems and therapies that we do not yet understand, or maybe we don't have our randomized clinical trial for, randomized controlled trial. So, I started learning and exploring more about that. And I learned that at one of the divisions of Harvard Medical School, I think it was the Osher Center, had been doing research on the benefits of meditation, acupuncture, and they were kind of at the forefront of things. So I thought, I really want to learn more about this. I want to be in an environment that is open to thinking about how there are these different unique systems all around the world that we could potentially incorporate to use in our clinical armamentarium, like what we can provide to our patients.
And I'm curious, over the years, as you took what you learned through that experience and integrated it with what you learned from traditional internal medicine training, right? Which is, you know, evidence-based medicine, rely on papers, get as much testing as you possibly can afford or the insurance will pay for. How do you integrate those things into your practice?
I think that actually they can be quite useful. And it reminds me of a patient that I worked with a few months ago while I was still in my primary care practice. She was coming in complaining of abdominal pain, cramping, profuse diarrhea. She was very concerned that maybe she had some sort of infection. She didn't understand why this was happening. This was someone who was like super motivated about taking care of their health. She was an older patient, So she was like tracking what she was eating, really trying to understand what was going on. And it wasn't clear. We did some lab testing, and initial labs came back normal. We look at your stool to make sure there's nothing growing. So we cultured out her stool. We look for ovarian parasites, nothing, which I expected that most likely that was going to be fine. And then, working with gastroenterology, we decided that she probably had something called lymphocytic colitis, and she had some inflammation in her colon. And you best diagnose that with a colonoscopy, and you can do a biopsy and you can see evidence of inflammation. But because of her age, we thought rather than put her through the burden of the colonoscopy, let's just treat her with medication, which is steroids. And before she started the steroids, she started to get better. And she came in and she said, I don't know, I'm starting to improve. I haven't started the medicine yet. And I said to her, I knew her well. We had a really good working relationship. And I said, listen, can I be honest with you? And she said, yes, absolutely, please. And I said, I really think you're stressed out. I think you're anxious. And I think you're having a bad exacerbation of irritable bowel syndrome. And she kind of broke down and said, yeah, you know what? I've been going through a really stressful time. One of my children is getting married. We have all of these things going on at home. And I've been so nervous. And it's been bringing back memories from her early life, where she had to flee her country. She had to move to the United States and didn't speak English. So like all of this was coming up for her. And she felt better without any intervention. So that's a long story to say that I use my skills and my understanding of mind-body medicine to help decide how aggressive do we need to be. I think I've used it to minimize extra testing for people. And so we can save money by kind of going back to the story and understanding, like, wait, there's something else that's stressing the system right now. It's nothing that we can necessarily see on lab testing, or maybe if we go in there with imaging, we can't necessarily find anything wrong. But if we just talk to the person, we can learn that there's clearly something that's upsetting her system. So I've found that that's really been very useful for me throughout my medical career.
Yeah, that's a great example of, I'll often have people come and they want so much testing. They're like, I'm sure I've got this and this and this. And then when you dig in on, how are you sleeping? How are you feeling? What's your stress like? Are you exercising? Like all those different things. Then you quickly realize, like, well, I want you to fix those things first, because like if I find that something positive on a test today, all that tells me is when you're really stressed out, when your body's doing really poorly, this is what your body looks like from a lab perspective. Right. And that's not nearly as useful unless they always live in that way. And then they need some mind body medicine. They need to learn the skills.
Right. Absolutely. That's kind of how I think about, I also think about when people report difficulty with sleep. I think of that as, that's like the lab biomarker. I'm having insomnia. It's not actually the problem. Oftentimes it's really just the symptom of the stress that's happening, behind the scenes.
Yeah, exactly. Well, we're going to fast forward in your career a little bit, and we've jumped around already, but so you finished residency, and I'm curious, everybody when we finish residency, we're like, we have different priorities. Some people are going straight to academics, other people are going straight to private practice. And I'd love to hear kind of your decision process, what kind of medicine you were looking to practice at that point, how you ended up at your first job.
Sure. Well, I had the opportunity during my primary care internal medicine residency to do a second continuity clinic. So all internal medicine residents have to have clinic 1/2 day a week where they see people in the outpatient setting as opposed to in the hospital setting. But if you're interested in primary care, which I was, you get to do that for a second half day. And for my second half day, actually negotiated working at the Institute for Mind Body Medicine, which actually was based at Massachusetts General Hospital. So Mass General and Beth Israel Deaconess, they're both Harvard affiliated, but they're still kind of like under different health systems. So it was kind of like going to play for a different team while I was still based at BI. But, everyone was really wonderful and very, very helpful in terms of helping me to achieve my career goals. So we were able to coordinate working at the Institute for Mind Body Medicine half day a week, and I was just absolutely enamored. I adored working there. I adored the whole team, what they were trying to create through their work there. I loved working with the patients, and while at the Mind Body Medicine Institute for Mind Body Medicine, what they would do is they would do an intake, which is what was my role while I was there, kind of like what's bringing you in, what are your medical symptoms, what's the level of stress that you're experiencing at this time, and then we would refer them to some of their different programs that they had. So they had programs tailored for people with cancer, kind of a basic stress management program, women for fertility, people with pain. It was quite wonderful. And so when I completed my residency, I was able to be hired full-time as one of their full-time clinical staff to continue that role after that. So I wasn't really sure where I was headed. I just knew I loved where I was. And so I tried to kind of continue and see, all right, what's this like full-time?
So you're kind of lucky enough to keep doing what you already loved, what you already knew. And tell us a little bit about how the journey, um, how you ended up at Bionic Health. Like, obviously, I'm
Sure.
taking you through many years, from
Yeah.
maybe
Many,
like
many,
2 years,
many years.
like
No.
2 years. I know you just like you're so young.
No. Yeah, well, so just to back up slightly, I met an incredible man during my medical school years, my husband, Martin. And we got married and moved to Boston. And I took him away from the beautiful, warm beaches of Bermuda, where he was living at the time, and brought him up to Boston, where it was cold and rainy and snow would stay around until like June. Um, so even though I was, learning a lot and learning from some of the experts in the field, we decided that it wasn't necessarily the environment that was healthy for us. It was great clinically and professionally, but for our health and what we wanted, it wasn't great to stay in Boston. So I love you, Boston, but we started to move south. It took a while for us to get down to North Carolina. We took a pit stop in Westchester, New York, which I grew up on Long Island. And my husband's from Pennsylvania, so I thought, oh, okay, this is kind of like a good sort of midway point for us. And I started working at a private multi-specialty practice, Scarsdale Medical Group, also with a bunch of amazing physicians that I worked with there. Loved all of them. And I started my own mind body medicine practice, and kind of I wore two hats. I would work in their walk-in clinic seeing, acute visits, and then I would also do my mind body medicine practice, or building it at the time. And so that was great because I get to hone my medicine skills still, and keep myself fresh, but also kind of learning and beginning to understand how to provide my philosophy in my own kind of clinic, what that would look like. So I worked there for some time, but again, we were kind of like not thrilled. We had just a new child at the time, and we were looking for something that was really, really better family oriented for us. So I saw this opportunity at Duke, and even though it was a shift away from doing mind body medicine, I felt like at the time I hadn't worked as a primary care doctor full time, and I just felt I have to do this. I just have to take the jump and start working primary care full time and just really hone those skills. So I spent the next 6 years working at Duke Primary Care, working with amazing physicians, great nurses, clinical staff. Absolutely love all of those folks over there as well. And I learned a ton of medicine while I was working there, more than I could have ever learned in residency. You know, you see a lot, but there's just so much happening in primary care, and took care of some incredible patients. It was really a privilege. So, but while I was working there, even though I was learning, again, so much, and I felt like I was doing a lot of good in the world, I definitely was not being healthy to myself. And it started to take a major, major toll on me and my family, which is typical for people when they experience burnout, right? It's not just affecting you, it's affecting everybody around you. I was tired all the time. My sleep was off. I would try to put my son to bed, and I would be reading a story and then snoring on him. And, we would be at events over the weekend, and all I could think about is the work that I needed to get done when I got home, or how much energy do I have left that I can conserve, because I know I have 3 or 4 more hours of charting to do tonight on the Saturday. So I started to just think about what would be really better balance. And God love you, Bionic Health, I found you. And I was invited to work with the team, so I'm super excited.
Yeah, we're so excited to have you here. I mean, lots of those things that you named are reasons we were so excited to have you. Obviously your broad expertise in primary care, mind-body medicine, so much, but that somebody is a great physician when they spend their nights and weekends charting. And partly, I'm not saying that you can't be a great physician and do all your charting in front of the patient, but there is something about connecting with your patient that just takes time and effort. And I feel like it's the hardest part of being a physician is slowing down enough to connect with the person, knowing that you've got this load of work that is going to keep you from your family and keep you from resting. And
Yeah, that was tough. I mean, I remember I didn't mention, but I also did a transformational fellowship while I was at Duke, kind of trying to study one problem area and think about how you can make some shifts in your clinic. And I decided to work on clinician burnout. Physician burnout is something that's super important to me and I'm passionate about. And I started to do some time studies on charting. And I noticed, our patient volume was seeing 18 patients a day, which, by kind of nationwide standards, that's actually pretty generous and fair to us. There are other people who see 24, 25, 30 patients a day. But if I took 5 extra minutes with each patient, that's almost 100 minutes, a little less than that, per day, just by spending 5 extra minutes with people. So, those numbers just added up so quickly. And sometimes, people come in, it's a 20-minute visit, but they don't have a 20-minute problem. So, and it was always like, well, what do I do? And there's something called moral injury, where you feel like you can't provide the care that you want to provide because of the limits of the system. And I felt like I was making that choice frequently, like, okay, I'm going to stay here and stay longer in this visit to take care of this person and give them the care that they need, knowing that, I'm blowing up the rest of the day. Or, I am going to be going home to work a lot tonight, but I didn't want to have to feel or experience what it felt like when I just was running out the door so that I could just, do the bare minimum. And not to say that didn't happen at certain times, especially when you have someone who's like ill or an emergency. I would be lying to say that I was perfect every single every single encounter. That's not true. But yeah, it was hard, and it's hard for everybody that's still out there. So I'm with you all, and I know that everybody that's still working out there in primary care, they give
Oh yeah.
200%.
Oh yeah. And it's interesting when people ask about Bionic Health, like often people think that what we're building is this concierge practice and we're just trying to take it easy. But the way I see it is we're building what medicine needs. We're going to build all the tools that primary care physicians need to make it faster and easier and more ability to connect with your patient, less time, worrying about things that are administrative. So I see the work you're doing today as actually kind of you're kind of like the special forces, right? Like you're working on things.
Love it. I'm a superhero. I'm special
Exactly.
forces. It's
Exactly.
great.
You can't pull the whole army away from what they're doing. Like
Yeah.
it's important the work that they're doing. And what we're doing is,
Absolutely.
hopefully transformational to all of healthcare eventually. So um, okay, next thing I had on mind for you is since joining Bionic Health, you've obviously you had a tremendous amount of medical knowledge when you joined us, but you've been digging in on all sorts of different things since joining. What are you most excited about right now? What are you kind of thinking about the most right now?
Um, I, you did not pay me beforehand to say this, but it's hard for me to say. I am super excited about everything. In fact, I walked in this morning and I said to one of our staff, "I'm super excited about this one thing. I was thinking about it this weekend." And that was our sleep module. But I have to say, it's hard between working on female health and our female hormone module, rather. But I absolutely love the fact that we do body composition testing and performance testing. And I really think that this can be so valuable for every single patient. And I wish that some version of this was available at every single annual physical and Medicare wellness visit. Because what we do with our body composition module and our performance module is we're looking at visceral fat mass, and we're looking at muscle, we're looking at strength and power, we're looking at mobility, and all of these things are super important to help someone live the life that they want for as long as they possibly want without having as much pain, injury, limitations. And I think if we asked our patients that question when they came in, like, what are you hoping for as you move on to those later years of their life, they're going to say, I want to remain as functional as possible. I want to be able to do the things that I enjoy. And by providing them this information, I think it's really eye-opening to say, wow, I'm actually not as strong as I thought that I was, or I'm really not very flexible, and this could be contributing to pain and injuries I'm experiencing. And oh, you know what? I shouldn't necessarily start that walking program as vigorously as I thought I should, because I really don't have the mobility and the strength that I need in order to even just do some walking. So I love that we offer that as part of our program. And I think it's super valuable. And I wish that everybody could participate in it.
Yeah, I mean, the more you learn about, I mean, we spend so much time memorizing drugs, labs, all those types of things. And we always knew nutrition and exercise was important. I mean, like, geez, you were talking about reading a book in undergrad that kind of pushed you towards primary care. Um, but like, the more you learn that having a strong body, how important that is, like, that's just going to change your life. And so yeah, getting the data, people aren't going to change if they don't know. If all they know is the
Yes,
number on the scale, that will do little to
absolutely.
make them change.
And I also think we have this like wrong framework that we are working with, where we're telling people you have to lose weight, but we're not telling them to build muscle. And you're hearing more about that in the media nowadays, that people are understanding that it's important to build strength and focus on strength. But I think we have been, myself included, doing a disservice by really just focusing on cutting back your calories, really just trying to eat healthier. We're not really focusing on helping people be strong. So I'm excited that you've opened my mind to understanding the value and benefits of that, and that we have the opportunity to provide that.
Awesome. Well, as we finish up, I'm curious, what are your strength goals? What are your goals personally? What are you going to achieve?
Oh, I'm super excited. I have been, so my goal is definitely to build up my physical strength overall, but I have completed my performance testing and I definitely have a lot of upper body weakness. So, but I'm starting with also working on my mobility, because I understand I can't go to full volume right off the bat. I have to kind of steadily build strength, also work on my flexibility, and then my cardiovascular fitness will gradually improve along with all of that. So those are my short-term goals. Long-term goals are to be super buff. No, not really, just to feel good, to be able to run, swim, be active, and not feel limited by feeling not strong.
Yeah, those are good goals. And we're going to carry those muscles long into our, I mean, I know you're in your 20s, but long into your 80s, 90s.
Well, my bionic my pheno age shows
I
I'm
know,
29,
I know.
so
Exactly. Yeah, mine does not. Mine does not show I'm 29. Well, Catherine, thank you so much for letting everybody else know more about you. This has been awesome, and I'm sure that people are going to be excited to have you as their physician.
I'm excited to work with
You
them.
bet.
Thanks,
Take
Jared.
care.